Hi, your child is now on anti-seizure medications and seizures have stopped completely. And your question is that can we stop the anti-seizure medications? If we stop the anti-seizure medications, will seizures come back again? I know it's a hassle to give the children the seizure medications. They do not understand why they're taking them. They're having side effects. It's affecting their development. It might affect their even cognitive function and school performance. So it is essential to make sure that they do need to take the anti-seizure medications, and if it's possible, to stop them when it is appropriate. And today we will learn together if and when it is safe to stop anti-seizure medications. And I believe that you are smart and can understand all of this discussion and even take what you learned today to your neurologist to have an interesting discussion, and he might think that you're a doctor too. The calculation and considerations of stopping anti-seizure medications is completely different from children and pediatric to the adults, because the cause of seizures and epilepsy in children is different than adults, and we're dealing with a growing brain that changes over time, so as the epilepsy, and it is possible that children will outgrow their epilepsy. This video is for children only, and we made a video dedicated for adults more than 18 years old, and I will link the video in the description below. And to get an excellent information about this particular issue, I have invited one of the world experts on pediatric epilepsy, Dr. Musa, who is a pediatric epileptologist at the Cleveland Clinic. The first question is, when is the best time to think about stopping anti-seizure medications?
In my practice, I always assess if they have a seizure-free period of more than 2 years. I assess them what is the tendency to have a recurrence of seizures if I take away the medications. That is medically treated patients. Unlike in adults, there are a few things that is different in children that probably the driving force for attempting to wean the medications. Number one, we try to avoid medication-induced cognitive effects, and especially in young children. The long-term use of medications could have some minor cognitive impairments. Number two, many of the epilepsies, children will stop having them as they get older. They outgrow the tendency to have the seizures. And number three, children are not driving. Especially before the teenage years and early teen years. If they are not driving, there is probably we can afford to take some risk of trying to wean the medicine and see what happens.
Recent guidelines from the American Academy of Neurology talking about stopping anti-seizure medications recommended to consider stopping anti-seizure medications when there are no seizures for 18 to 24 months, which is 2 years, and there was no difference between waiting longer for between 2 to 4 years. So now we can always consider stopping anti-seizure medications after 2 years of no seizures completely. The good news is about 60 to 80% of the seizures will be completely controlled and will not happen with medications. And on the other hand, the risk of seizures coming back after stopping the anti-seizure medications can range between 40 and 60% and can vary based on cases. And at the end of this video will give you a tool that will calculate the exact percentage of your seizure recurrence. First of all, here we're talking about kids who have completely stopped having seizures and had no seizures whatsoever. If the child is still having seizures, even rare every 6 months or every year, we cannot stop anti-seizure medications. And it is important that stopping anti-seizure medications always comes with the supervision of the treating doctor. And the second question is that if we stop the anti-seizure medications and the seizures came back, if we put the medication back again, will the seizures be controlled or will be completely out of control? So this is definitely a concern for both the doctor and the patient and their family. The good news is about 90% of the time, the seizures will be completely controlled back with the same medication that we stopped. And there is a chance that seizures can be out of control again, and this can happen in about 5 to 10%. It is still a low possibility, but we always have to consider that. And the other issue is that sometimes if we stop the anti-seizure medications, seizures can come and be aggressive and can last longer in some cases, also rarely, and this is called status epilepticus, and in very rare occasions it can be long and life-threatening and even causes death. And it is important to understand that when you are thinking about stopping anti-seizure medications. Please let me know down in the comments below, are you willing to take the risk and stop your anti-seizure medications? All right, to make your life easier, we put together the best and most important 7 factors that contribute to seizure recurrence. The first factor is EEG. It is important that EEG measures the electrical activity of the brain, and every time we stop anti-seizure medications, we do an EEG so that we can see the brain electrical activity. And if we find normal EEG, that's a good indicator that seizures will likely not come back. However, if the EEG is still showing epileptiform activity, which is excess electricity in the brain, then that might be a major concern that seizures will come back. So if we stop the anti-seizure medications, this electrical activity will grow more and cause seizures to come back. And sometimes the EEG can be normalized by the anti-seizure medications, and it is sometimes wise to repeat the EEG follow-up after the seizure medications are being weaned off. And the second very important factor is the cause of epilepsy. There are multiple different types of epilepsies and causes, especially epilepsy syndromes in children.
There are certain patients, for example, there are self-limited childhood focal epilepsies, also called benign Rolandic epilepsies. We know for sure that they outgrow for 100%. Their tendency to outgrow happens in the late childhood years. By 12 to 14 years of age, more than 90% will stop having seizures. By adulthood, nearly all of them will stop having seizures. Those decisions are relatively easy. We know the syndrome, we know the diagnosis, we know the long-term outcome. We, after being seizure-free for 2 years, we often do an EEG and then discuss about weaning off the medications. In other times, for example, a child has got a focal malformation in the brain. Their chance for outgrowing is very low. Okay. In those case situations, we may continue the treatment for a longer time. If you do not know the etiology, the patient has an unexplained, which is a fairly common occurrence, 20 to 30% of children, we may not find a clear cause for epilepsy. In those patients, if they achieve seizure freedom, I do tend to come off the medicines after a 2-year of seizure-free period. We do an outpatient EEG, preferably with the awake and sleep record. And the EEG is negative. I don't have any reason to believe that there is a strong tendency for recurrence of seizures. We wean off the medicine slowly.
Also, special generalized epilepsies have their own risk of seizure recurrence.
So again, it depends upon the type of generalized epilepsy. The classical ones are the childhood absence epilepsies. They have only absence seizures in a classical onset between 6 to 10 years of age. Again, 2 years of no seizures, we reassess the EEG and come off the medicines. There is and the chance for outgrowing is not like your benign focal epilepsies of childhood, but still fairly 60 to 70% or even more chances in the childhood absence. When they have absences persisting in teen years, or what we call the juvenile absence epilepsies, the remission the chance for completely outgrowing is diminished but not absent. So again, we reassess at 2 years. There are certain epilepsies like a juvenile myoclonic epilepsy, where we know that they are fairly not easily controlled. Many of them are fairly controlled with medications, but when you come off the medications, they tend to have a recurrence of seizures. They are usually adults by that time. There is some recent information that says that about a third of patients, if they are seizure-free for 10 years, could be tried on weaning off medications. But again, this is an adult, I'm getting into the adult world here. I do not see many adult patients.
And the third factor is the age when seizures started. The best time when seizures are starting and they do not come back is between age 3 and 4 years old. And early on seizures, early in life, the children were born with seizures, that has a much higher risk of seizures coming back. Also, if seizures started late in childhood, between ages 10 to 15, and that means that the mature brain has epilepsy, and that will likely last for longer time. And the fourth factor is the duration of epilepsy. The longer the brain having seizures, the more it is ingrained in the brain that the seizures are happening and the networks are strong. So the more the seizures have been happening, the harder to control them and the more likelihood of the seizures coming back after stopping the anti-seizure medication. And the fifth factor is the seizure types and frequency. So we know that the best type of seizures, if we have only one type of seizures, and it is generalized seizures like absence seizures or generalized tonic-clonic seizures, that is better than focal seizures. And the worst thing, if your child is having multiple different focal seizures, that means that there are multiple areas of the brain that are causing the seizures to happen, and they can come back after stopping the anti-seizure medications. Also, the amount of seizures happen before being controlled on medications, and the magic number here is 10. So likely less than 10 seizures, that's a very favorable outcome. And more than 10, usually the seizures will tend to come back more frequently. And the sixth factor, if there is developmental delay and intellectual issues, that can increase the risk of seizure recurrence, so as if there were history of febrile seizures and if there is a family history of epilepsy. And the seventh factor is medications use. So how many medications have been used to control the seizures? And it is very important that the less amount of medications that were needed to control the seizures, the better the outcome will be. So if your seizures were controlled on one medicine, that is great. If it needed 2 or 3 medications, usually if we stop those medications, the risk of seizures coming back is higher. Okay, let's put everything together, and for that I'll bring my laptop and we will put all of those in one place that will calculate your seizure recurrence. This is the website that we go to. It is epilepsy prediction tool, and it should be done through your doctor, but you can access that website and look yourself and see your own numbers. So when we start, we have ED withdrawal, anti-epileptic retrieval, so with go, and then here are multiple things that we have that we can put in and plug in. And so we put in the years. So let's say like it took us how many years duration of before remission, like 4 years. Let's say that since the last seizure, let's say like we started doing it 2 years, and then number of AEDs, we have like one medication, age of onset of epilepsy was 5 years old, male, negative family history, history of febrile seizures, number of seizures. So we kind of plug in all those information, if there is developmental delay, focal seizures, normal EEG. And then after we finish plugging all the details, we hit look up, and that will give us the estimation of seizure recurrence for 2 years. So in this case was 41%. And then the estimation for 5 years recurrence and even 10 years of chances of seizure freedom for at least 1 year. Means that seizures might come, but just like for 1 year completely free. And it is important to look at those numbers in the context with your doctor, because it can be different from one person to another. And these numbers are not obsolete, but they give you excellent clue about your own seizure recurrence. All right, so now we decided to stop the anti-seizure medications. How long we need to wean the medication? Well, the weaning process of anti-seizure medications takes usually between 2 and 3 months, so that it can be safely taken off, and we can have a longer weaning schedule if the child or their families were a little bit anxious about seizures coming back. All right, in the special situation of epilepsy surgery, can we stop anti-seizure medications after having a successful epilepsy surgery?
There are some certain exceptions. When we do epilepsy surgery, we do not wait for a 2-year seizure freedom. It also depends upon the number of medications they are on. Generally, if a child is on one medication after epilepsy surgery, we decide to come off the medicines 1 year after the epilepsy surgery. If the patient is seizure free, if we think that the chance for remaining seizure free is high, the EEG is not showing any abnormalities that is not expected, then we come off the medications slowly. In other cases, for example, an infant, a 10-month-old, 4 medications, malformation, you do the hemispherectomy. I don't wait for 1 year to wean off those 4 medications. Sometimes I may be weaning off medicines within the 2 weeks after surgery, because I want to avoid the medication load in that baby, which presumably had a surgery that is highly successful. Okay, so in those cases, I may even wean off cutting down medicines within 2 weeks after surgery. My general rule is, if a child is on one medicines, I wait for 1 year after surgery to come off medicines. Child is on 2 medicines, I assess at 6 months to decide to come off one medicine and remove the other medicine at 1 year.
It is very important to understand that things are completely different between children and adults in this situation. And also it is different from one case to another. And we're talking now about epilepsy surgery when there is like an area of the brain causing the seizures was taken out and the seizures have completely stopped after the surgery. And to make sure that your seizures continue to be under very good control, I put together the best 10 tips that you can follow to make sure that seizures will never come back. And don't forget to subscribe and see you in the next video. Salam.